Bell's palsy, when half of the face stops listening. Imagine waking up one morning and realizing something isn't right. Meet Rhea. She walks to the mirror and notices that the right side of her face isn't moving properly. She tries to smile, but only one side lifts. She tries to close her right eye, but it won't shut completely. Fear immediately sets in. Am I having a stroke? After a medical examination, the doctor gives her an answer. Bell's palsy. Bell's palsy is a sudden weakness or paralysis of one side of the face caused by dysfunction of the facial nerve, also known as the seventh cranial nerve. This nerve controls facial expressions such as smiling, frowning, and closing the eyes. It also carries taste sensations from the front part of the tongue and helps control tear production. The facial nerve passes through a very narrow bony canal near the ear. When the nerve becomes inflamed, often after a viral infection, it swells inside this tight space and gets compressed. As a result, the signals from the brain can't reach the facial muscles properly. This can lead to drooping of one side of the face, difficulty closing one eye, loss of forehead wrinkles on the affected side, drooling or difficulty drinking liquids, changes in taste sensation. But Bell's palsy isn't the only condition that can cause facial weakness. Doctors must also consider other possibilities such as stroke, especially if there is weakness of the arm or leg, difficulty speaking, or forehead sparing. Ramsay-Hunt syndrome caused by reactivation of the varicella-zoster virus, often associated with ear pain and a rash around the ear. Lyme disease, particularly in endemic areas. Tumors affecting the facial nerve. Trauma to the head or temporal bone. The good news? Most people recover completely, especially when treatment is started early. Treatment usually includes steroids to reduce nerve swelling, eye protection with lubricating drops or an eye patch, and sometimes antiviral medications in selected cases. But here's the key message. If someone suddenly develops facial weakness, don't assume it's Bell's palsy. Seek medical attention immediately because conditions like stroke need urgent treatment. Because sometimes a tiny nerve can create a very big change. Clinical snapshots. Learn medicine through stories. A stroke typically spares the forehead, whereas Bell's palsy affects the entire half of the face, including the forehead.